We're here to discuss using fecal transplants to get rid of antibiotic-resistant genes in a patient. So what we were looking at is whether or not we can change the number or type of antibiotic resistance genes that are in a patient. So antibiotic resistance is a huge problem. We all carry within us a lot of bacteria that are resistant to antibiotics. And the problem is when you get infected with these bacteria, there's no way of treating you because there's no antibiotics that can treat these antibiotic resistance bugs. So what we have shown in this is that we can get rid of these bugs by doing a fecal transplant. It was very successful. I mean, for C. difficile treating those patients, we have about a 90% success rate after one infusion. And when we went on to do a further analysis of how we changed the microbiota, we could show that we had a very significant reduction in the number of genes that were antibiotic resistant in these patients. So right now we're looking at other conditions for treating chronic diseases such as inflammatory bowel disease, liver disease, irritable bowel syndrome, a lot of other conditions. But what's really interesting about this is the fact you can take a patient who's very sick to the hospital with an infection that does not respond to antibiotics. And as I said, there's no treatment for these individuals. And so we can try now to use a fecal transplant on these patients to make them at least responsive now to antibiotics. The long-term effect of fecal transplants is really not known. In the Clostridium difficile population, there are none at this point. It's all upside and not a lot of downside. To show now that we can go into a very sick patient with these type of bacterial with resistant genes and treat them successfully.